I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. And as always, I have these exceptional guests, these experts in their particular field of what it is that they do that are game changers that can absolutely change your life as well. So you want to tune in and listen in to what you're going to find out for today. And with these two individuals, you definitely want to listen to the last one that we had, and it's all about concussion and some of the symptoms that oftentimes will go unrecognized. So what's different about this podcast? Well, we're not selling anything, and we're not, selling any kind of service or promoting any particular person. What we're doing is we're sharing with you the process by which you can make better decisions for yourself or for someone else when it comes to your health. And how do we actually do that? We do that through a role play. So for about 6 minutes, my two guests will be role playing. One will present with a problem, and then the other will act as a guide, and through a dialogue, come to some form of resolution. Now, you might think 6 minutes is not a lot of time, but you'll be surprised what we can achieve. But more importantly, if you find some judgment, if you find that you are triggered, or there's some sort of internal voice saying, this is kind of weird, here's the thing. That's the inside voice telling you, you better listen in, because there's something relevant here that's causing some sort of dissonance within you. Or maybe it's just that you realize that this is really good stuff and, I can learn something. So the hope is for me is that you leave with some sort of insight, some sort of action step that you can then take in order to help yourself or someone you care about with a particular problem that we're going to be talking about today. And so, first of all, we want to introduce Dr. Jeremy Schmoe and Dr. Paul Brewer. They will introduce themselves briefly. We'll then go into that role play, and then we'll do the unpacking after that. Dr. Schmoe, introduce yourself, and then we'll go with Dr. Paul.
Yeah, so my name is Dr. Jeremy Schmoe. I'm the founder and director of the Functional Neurology Center in Minnetonka, Minnesota. I'm a board certified chiropractic neurologist, and I also lecture for the Carrick Institute. My whole practice are, patients with lingering post-concussion symptoms, dizziness, vertigo, movement disorders, balance issues. So we're all about improving people's brain health and performance.
Awesome. Dr. Paul?
Yeah, I'm Paul Brewer. Originally from Hawaii, now based in Boise, Idaho. My practice is Divergent Neurovision, and mostly what I'm doing is neurooptometry. So I work with patients that have eye or vision issues, tracking, eye teaming, eye focusing. I also work with concussions, and a big part is working with sports enhancement, helping athletes reach a different level of performance.
Wonderful. And what you guys do is actually exceptional. I'm in awe, after our last episode that we had, Pain to Purpose, your stories are incredible, but more importantly, pioneering the pathway forward so that other practitioners can understand how to best support people with all sorts of, concussion issues and other sports, conditions that many of these athletes experience. So Paul, I understand that you're going to be presenting with a problem, and Jeremy is the guy.
Yep.
Go ahead.
Hey, Dr. Jeremy. Man, I've been doing pretty well in hockey, but recently I just haven't been myself. I'm feeling really off. I got wrong in the last game, and headaches, and I just can't focus well. But I also heard from a friend of mine that I heard my friend work with you, and he said you really helped them out, and what I'm here mostly for is I want to perform better. I literally want to get better and perform better than all the other goalies in the league.
All right. Yeah, so I mean that's a common thing that hockey players come in to see us for. There could be a concussion history, so we'll ask you some questions about your concussion history. Were there any other injuries that you've had leading up to this? Was there any other past concussions that you've had or anything like that?
Man, I can't even tell you what I've had. My neck hurts, my back hurts. I mean, everything hurts, and I just play through it. This is how I was always raised. You just play through it.
Yeah, so that's really common, and I can almost guarantee you that there's been some times where some of these hits that you've taken have impacted your brain and your brain health and your performance. So really, what we're going to do is look at this from a multifaceted approach. We're going to really in-depth examine your nervous system. We're going to look at your gait. So we're going to watch you walk. We're going to look at your arm swing. We're going to look at your stride length. We're going to get a good idea of, do you know where your body is in space? We're also objectively going to graph out your balance. So we're going to do eyes open, eyes closed, flat versus foam. And we're even going to go as far as putting you on a virtual reality device where the platform actually shifts and moves. And we're going to see if your brain is firing the connections from your vestibular system down through your spine, down to your legs to allow you to be stable. So I just saw an NFL player yesterday who had a concussion last season. He came to see me, not a lot of symptoms, but when we put him on the virtual reality platform and we started shifting him and moving him, his vestibulospinal reflexes, the reflexes that are important for posture and balance, they were not engaging the way that they need to specifically. So therefore, he looked really, really unsteady, and he was doing all this posturing with his neck and his shoulders. And really what we want you to be able to do is have a good connection between your brain and your legs. All right. It's so important for that leg stability and body awareness. So we're going to look at your gait. We're going to look at your balance. We're also going to look at you structurally. So we're going to assess, TMJ biomechanics. We're going to look at your cervical spine. We use a device from Iceland. It's called Neck Care. It's a goniometer that you place on your head, and we're going to be able to look at all of your neck proprioception. So does your brain actually know where your neck is in space? And we do a test. It's called the butterfly test. So there's going to be a target that moves. And basically, we're actually going to graph out your neck movement. So does your brain have a good idea about actually where your neck is in space? So some people don't have all the neck pain, but they might not have good proprioceptive feedback from their neck into the brain. All right, the next thing that we're going to do is we're going to look at all your eye movements. So we're going to look at, can you keep your eyes steady? Can you follow targets? Can you move your eyes quick? Can you tolerate rapid visual motion? And we're actually going to graph your eyes out with something called VOG. It's called video oculography. And it's really important to actually put your eyes in the dark and see if, when you can't see anything, if your eyes look like they're drifting or shifting and moving. All right. Your brain needs those eyes to be steady. And being a goalie, it's very important to have a good vestibular system. So if your eyes are drifting in ways that they're not supposed to, then there's something off. So when you get these hits, the force enters into the brain and it changes the integration of these nuclei that control where your brain knows where your body is in space. And ultimately for performance, that's a key aspect. All right. We're also going to use a device. It's called ReadyTrack. It's a laser scanning retinal device. It shoots a laser into the back of your retina. It's going to scan your retina and look at movement very precisely to 0.1 degrees of movement. So just give you an example. We just saw a lady yesterday, and her eyes, when you put her in the dark, are just shifting like this side to side. But when we graphed her eyes out with the ReadyTrack, her eyes were actually consistently going down and then beating back up like this. All right. So when she closes her eyes, she can actually feel her body shifting and moving, but she doesn't even feel dizzy. But it can still affect your performance. So if if you're an elite hockey player, you need all your eye movements to be very integrated to give you a good ability to have these good reaction times. So we're really going to try and put it all together, and also look at your heart rate, your blood pressure, listen to your gut, look at your pupil size. So we're going to give you a very in-depth exam on your nervous system, and I'm going to design a really specific program for you. And a lot of these things you can do at home. But if I do see some things that look pretty off, we got some pretty cool technology of things we can do in the office to rehab you. Okay.
Awesome.
That's amazing, gentlemen. I think we could go on forever talking about this topic. Like to start off with Paul first. Give us some context and what was that all about for you?
So context, I mean, like, again, that kind of resonates with me and how I, played sports. And it's interesting because I heard Jeremy speak before, but like hearing him speak to me as if I was a patient, even though I'm like, a fake patient, it's like, it resonated with me, if that makes sense. I was like, oh, wow, I can actually get better.
Right.
Like this stuff that he's talking about, I can actually feel normal again.
Yeah.
And one thing he brought up, which I kind of knew about this before, but like I want to bring up this point about TMJ, right? I mean, like a lot of people think that TMJ is completely separate, but that's how interconnected everything is and how things can cause other things. And sometimes we're like, oh, TMJ, so we gotta get a massage or go to a dentist that takes care of it, or maybe a regular chiropractor or whatever, instead of like a functional chiropractor. So you go all these different places and you forget that it's connected with the other systems.
Yeah, and I'm going to add to that in a moment. But first, Jeremy, what was that for you? Give us context.
Yeah. So I mean, that's exactly how I talk to people when they come into the clinic. And then if they don't understand what I'm talking about, then I make things way more simple. Like your brain just wants to know where your body is in space, and people understand that. Because if they've been dizzy or they have vertigo or they feel weird while they're out there driving, it just affects where you perceive that you are, and then that gives you a lot of symptoms. And another thing is, like, concussions don't have to be the end of the world. All right. You can rehab these issues, and then you can move into elite performance. And I think you can get people back and better than ever before. So, there's a lot of things that can be done to improve your neurology.
That's amazing. And so just want to share briefly, and I know we only have about 10 minutes on this show, but what's clearly important and is that, many people have these issues. They definitely go unrecognized. But what I think is even more relevant, and I appreciate the fact that you guys are beginning to look at things differently in a more of a unified fashion. But the reality is this, is that, with the 70 trillion cells and the 10,000 named parts, we have a very complex, body here and design that we don't even begin to understand at the 1% level, perhaps. And simply because that, the basis of our studies over the last 200 years is based on Newton, and it's all about the reductionism and materialism and determinism. And so we're looking at things at the smallest unit, where that's not where the answer is, because the other truth is, one thing that the way the body communicates at the speed of light is through all the muscular connections and musculoskeletal connections, like the fascia. And I'm trying to keep the word simple here. And I would say most of my colleagues don't even have any concept of what that is really all about. And so when you do get a concussion, it causes inflammation and causes scarring. And then there's other parts of the body that's been disrupted through trauma. Guess what? It affects every single part of the body. And unless you begin to look at it from that context, which is what you guys are doing at a very high level, you're not going to get the sufficient resolution that you desire. And so that's the beautiful thing that I think that's happening nowadays, particularly with the work that I'm doing, is how do we unify all of that? Because clearly, at the level of knowledge that you have, you still you can't know everything. And so working together at the highest level and the highest specialties is what's key. Want to give Paul first word follow up?
Yeah, so basic take home is that, like, I think that we just need to like educate people more. A lot of times people are having these issues and they go, I mean, it's not just a month or 2 months or 3 months, it's like years after the fact. Years after the fact where they're having an issue that's making their lives a little bit harder, and they have nowhere to go because they've tried every single doctor, and every profession has doctors that specialize in this. They just haven't found that doctor, if that makes sense, which is really hard because I think as a medical profession, we tend to diagnose, treat, and we box ourselves in our own professions when really we should be learning about other professions and what they do, so we are able to refer more regularly. And that's the biggest take home for me, is that we just need to work better together and understand each other and understand we all have limitations as well.
No, and I would agree. And what's interesting, though, in this new millennium, I think we've done a quantum leap as far as technology and understanding. But quite honestly, it's been led by all the non-MDs. And so I say that with a bit of tongue in cheek, and it's a little bit comical for me. But, as MDs, we've been, slotted into this pathway to view things in a certain way. Whereas you guys outside of that system have had the freedom, the luxury to say, well, hang on a second, there's a lot more outside of what we already know that's not in alignment with traditional or conventional medicine that has answers. And because of that, so many entrepreneurs and innovators like yourselves are finding out all these different things. And now it's a matter of, okay, let's all work together. Jeremy, thoughts?
Yeah, one of the things I was going to bring up too, just from me growing my practice here in Minnesota, I've referred so many patients out of my clinic to go see other providers for things that I've examined them for and found, you know what, I think you might have mold going on here. I actually have a
Yep.
provider that I work with that is really talented at working specifically with mold. So I kind of have my mold person that I work with. I also have a really good DO that I work with that all he does is hormones. And then I also have, I have an upper cervical chiropractor that I refer to. I have a functional dentist that I refer to. I have a group of neurooptometrists that I refer to, the different neurooptometrists around the city. So by me not trying to do every single thing, I've actually built a huge network, and I've gotten a lot of people sent back to me from
Yep.
all of those other providers. So I know other providers might be scared to be like, oh my gosh, I'm just going to, I'm going to refer people out and not try and do this. It's better just to get the person better.
Yep.
If you get the person better, and then they tell all their other doctors, like, you're going to get more patients referred to you. So like from that aspect, from a practice building aspect, integrating and working with other people has done very well for me.
No, and I love that. And that's just a testament to your openness and recognizing that the other practitioners are not your competitors.
Yeah.
And unfortunately, I think too often, at least in the medical field, that's how we've been trained. But I'm not going to go down that rabbit hole. It is what it is, but it's time to make some changes. But one thing I can certainly help you, and also for the listeners out there, because of this new technology, these brilliant people that have been working the last 20 years, oftentimes their own pain to purpose story, there are things like a bioscanner that can actually identify very quickly if somebody has a mold, has other hormonal issues that you can do easily in your office. And now you've got even more, you're adding even more value to your patients because you're diagnosing things that nobody else is. In addition to that, there's another tool for people out there, and I'm happy to introduce that to you as well. And that is this, is that, we have the genetic blueprint for a perfectly functioning body, as well as a blueprint of the body that's not working well. And there's only one company out there that's called a DNA company that absolutely is dialed into understanding the connection between your DNA, your genetics, and all the different metabolic pathways. So they have the ability to give you a very specific roadmap. So once again, very, very affordable, procedures or assessments that can support, your desire to help people, but also the listener to understand with this data, what's wrong. I mean, both of you are very precise. What I like about what you're doing, and I think a new term is coming out, and as I like to call it, natural precision medicine, stepping away from, drugs and surgeries, where very precisely you're measuring, which is what you both are doing, but also incorporating different, treatment strategies like you were sharing earlier, Jeremy, specifically, what are some of these, eye exercises that you can do? I mean, that's mind blowing. I mean, now, basically, as Paul was saying, now there's hope. Now I can help people be happy. That's amazing.
Yeah,
Any more thoughts from either of you?
Well, I mean, that's what it says on our door when you walk through the clinic. I mean, it says there is hope. It says Functionality Center, there is hope. So, I mean, if people come in, with that mindset that they can get better, I think it really sets their nervous system and puts them in a place where they can build plasticity. So a lot of people have just been, passed around, not gotten the best care, and they've lost all hope. I really think that's what me and Paul, bring to people with some of the more advanced things that we're doing.
I love it. And I'll champion you guys as much as I can. Well, let's wrap it up. Paul, just let the world know, how do people get a hold of you? Any final thoughts?
Yeah, you can get a hold of me, divergeneurovision.com. I'm on LinkedIn at Paul Brewer. Instagram, Facebook as well. So those are the kind of channels you can get a hold of me on.
Great. Jeremy?
Yep. So my website is thefnc.com. And, we're located in the clinic's called the Functional Neurology Center, and we're located in Minnetonka, Minnesota.
Great. Well, I want to thank you both. This has been one of the most exciting ones so far, and I don't say that all the time. But truly, I got educated. I have more hope for those out there because of people like yourselves. I mean, there's nothing more frustrating when we are not able to help our clients. One of the things as a plastic and reconstructive surgeon, what's fun about me is that, my outcome with all my patients is that they're happy. Yes, it's a different kind of specialty, but at the end of the day, it's for everyone. And that's why I've stepped into the world of health optimization and leading the way to making it ridiculously easy for people to optimize their health. There's so many brilliant people out there doing all sorts of things. I'm just bringing it all together because there's another term for hope or definition from hope. I got this from an amazing human being. She's called my daughter. And hope means hold on, pain ends. And so that's true for all people. And I want to thank you once again, both. You guys are amazing. Looking forward to doing a lot more with you, supporting you, getting the word out, whatever it is that I can do, because what you do nowadays is really, really, really important. So thank you. And my name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. And we will be back for much more amazing people like Jeremy and Paul. Thank you so much.